Am I audible?
Yes, you are audible. Namaskar, I'm Ravi Gupta. I welcome you all to the Digital Health Conclave, and this conclave is being organized in association with AWS, and we have with us Shri Abhishek Singh with us, who is the CEO of NEGD, and also he is the person who is leading the MyGov initiative as the CEO of MyGov. So, Abhishek, this event is we are organizing virtually, and we are going to discuss about digital health and IT in health initiatives. And we would like to request you to talk about what are the initiatives which Ministry of IT, MIghty actually, MEITY, is going to work on in the field of IT and health. And I think Abhishek is in the vehicle, and he's in he's on a car, so he has some connectivity issues. I think he's going to join. Uh, can you switch on the camera, Abhishek? Yes, we can see you. So, Abhishek, we would request you to please talk about the IT in health initiatives which MIghty is planning, and NEGD is also working on, and your the vision for IT in health. Abhishek, over to you. You are on mute, Abhishek. Please
Am I
unmute.
audible? I can't hear
Yes,
you,
yes.
Ravi.
Oh, am I audible, Abhishek? Am I audible?
I can't hear you. Can you hear
Okay,
me?
okay. Yes, I can hear you. I can hear you very well, and I am just putting a earphone here, a earphone now. So, am I audible, Abhishek? Am I audible? Hello, am I audible? Abhishek, am I audible to you? Hello, am I audible, Abhishek? I can't. Some connectivity issue here. So we will try again to connect with Mr. Abhishek Singh. Uh, Let me just connect here, and hello,
Now I
Abhishek.
can hear you. Now
Yes.
I can
Oh,
hear you. I re-entered. I exited and re-entered.
fantastic, yeah, fantastic. So, Abhishek, this is a conclave we are doing on digital health, and there are several great speakers who have joined in from India and abroad. And what we would like to request you to talk about IT in health, the vision of Government of India, and especially MIghty. How are you are planning to roll out IT in health initiatives? Abhishek, over to you.
Yeah, thank you, Ravi, and thank you for giving me this opportunity. And sorry for the technical glitches that were there, which caused a delay in starting of the session. But as far as health is concerned, today it is at the topmost agenda item for each one and everyone, especially in light of the pandemic, and especially when the time has come wherein, because the pandemic, people are not able to visit to a health facility or to a doctor. The importance of digital technologies, the importance of telemedicine, the importance of remote consulting have become all the more important. So, with that in the background, I would like to mention, like, the recent advancement, especially in India, that has been done, especially with regard to the National Digital Health Mission, which seeks to provide transform health services by using GPs. Not only in various ways, in basically analyzing the health data, in analyzing the immunization data, in analyzing how epidemics spread, but especially in the light of the present pandemic, the way people have been accessing doctors over a telephone call or over an internet connection has really helped in providing better access to healthcare to all. One example I would like to give is that across India, if you look at the basic primary healthcare, we have a huge shortage of super specialist doctors. And very often, specialist doctors are available only in big hospitals and metro cities and not available in rural areas. But with technology today, it is possible for primary health centers and community health centers in rural areas to connect to bigger hospitals, to connect to specialists in bigger hospitals and get their advice with regard to what is to be done. So that has become like a standard practice which was being done in other parts of the world earlier. The other big move that has been done is to move towards an enterprise architecture framework in healthcare. As we all know, the National Digital Health Blueprint was brought out by Ministry of Health last year, and that has laid the foundations for building the National Digital Health Mission, which is currently under implementation in 6 union territories, which seeks to give every citizen a unique health ID, and that will link all his medical records, all his health records onto a health vault or a health locker. In the present phase, the health locker has been identified as part of the DigiLocker, and what it does is that if you have medical reports or health reports or diagnostic reports from any health facility across the country, that report is stored in your DigiLocker, and that's accessible to you and with your consent to any other health service provider. So for example, if you have a X-ray from say Medanta Hospital, or if you have a CT scan from say Apollo, and suppose you want to have a blood report from Dr. Lal Path Labs, and if you want to share these to a doctor in Max for getting an opinion, you will have the right to do that. You don't need to do the test again, and you don't need to preserve paper copies or films of your test reports. So that really has a potential of empowering citizens in ensuring that they have control over their health records and they are able to analyze their health data with data analytics. The tools that are available today will also give an insight into the overall health condition of the person and give him advisories with regard to what he should do, what he should not do. The second thing that has been worked out in this field is once you have the health data and once you have the analysis for there, it can mean regarding public health care. Like once we get to know that what kind of diseases or what kind of ailments are there in what part of the country and in what season, one can take remedial actions in time to ensure that necessary help is provided to people of that area. So if there is a particular area in the country which is prone to say dengue, then necessary efforts, and if this data comes in from digital health records, because with paper-based health records we never get to know what is the extent of an ailment in a particular geography. So with that kind of health data, analytics can be built up, and that can help draw conclusions with regard to what kind of intervention is required to create a sub center. Where should we locate a primary health center? The other way in which technologies are going to play a big role is the COVID-19 vaccination program. Like as we all know, India has made the CoWIN platform for enabling uh, access to vaccines for each one and everyone across the country, and that's a huge task because there are several issues involved there. Vaccinating a population of 1.3 billion is not easy. So, and there are policies with regard to who gets the vaccine first. So, as per the policy, the frontline health workers are to get first. The people above the age of 50 are to get first. People with comorbidities are to get first. People who are in the law and order function, they have to get first. But how do we ensure that? How do we enable that? That would require a technological backbone. That will require tracking each and every vial of the vaccine with maybe a blockchain enabled network, so that we are not able to we're able to face the challenge of fake vaccines also which may arise, and at the same time we are able to ensure that the cold chain of the vaccine is preserved and people are able to get the vaccine at the right time and the right priority, and there's no confusion with regard to that. So uh, these have been the major initiatives with regard to the role of technology in healthcare. And if you look at the aspect of it, the maternal health care, the whole nutrition program, the RCH program, everywhere the data that emanates from the health records of a person gives an insight into what needs to be done next. For example, the ICDS program, which looks into the nutritional aspects of children and nutrition aspects of pregnant women, they also begin with the data that emanates from the RCH program. So there also with the health ID, once the Anganwadi workers or the ANMs or the ASHA workers get to know with regard to which are the women who need supplements with regard to iron or with regard to folic acid, they are able to take necessary action with regard to that. And today, with when data is available with regard to these aspects, other technologies like AI and data analytics are also playing a big role in trying to improve healthcare. Again, a very interesting example taken, which has been implemented in Meghalaya, wherein in a district collector started getting the data with regard to better who would require help, who may have complicated pregnancies, and they may require some help during their on the date of their delivery or around that point of time. Since the district had very few ambulances, they used this data, and with the expected date of delivery, the ambulances were placed in the respective villages, and so that all those women who had complicated pregnancies were brought to a health facility and given necessary care for institutional health delivery. So this simple intervention helped with digital technologies helped improve the institutional health delivery percentages from around 40% to 75% in around 1 year time. So very simple example, and now that project is being scaled up across Meghalaya. So there are numerous examples in which technologies have been used for helping improving healthcare. Use of AI in healthcare has been very popular, very common. We all are aware of the role technology has been played in detecting diabetic retinopathy, the use of artificial intelligence image processing for detecting breast cancer cases. So all that it does is that it's very simple to, if we are able to collect the respective data points and compare it with the data set that you already have, you're able to predict whether whether there is a case of diabetic retinopathy or breast cancer that might be possible, and that kind of addresses the lack of specialist doctors or lack of breast cancer screening or retinopathy screening. So this has transformed several lives in several parts of the country, and more and more research, more and more companies are working into this field and trying to ensure improvement of healthcare. The role played by Arogya Setu in controlling COVID-19 pandemic is well known. India was one of the first countries in the world to design a contact tracing app, which helped in alerting people if they had come in contact with anyone who has been tested COVID-19 positive in the previous 14 days. It became one of the largest apps to be used for such a contact tracing for tackling COVID-19. In fact, the number of users of Arogya Setu today is more than number of users of all such apps across the world. And somewhere we can say there are a lot of factors which have contributed to India's low fatality rates for COVID-19 or low cases per million as compared to other countries. And some role has been played in augmenting the efforts of the frontline health workers by the Arogya Setu app. So all that I would like to say is that technology is there in healthcare. Technology will be there for a long time to come. It's going to revolutionize healthcare, and it will have added benefits with regard to applications in health insurance, in applications in providing connecting hospitals, in applications in health research, and we will be able to see these results in the days to come. So I would conclude by that, and thank you for giving this opportunity for being amidst me on this occasion.
Thank you, Abhishek, for joining us in spite of your busy schedule. I think you are running between meetings. Last one line I want to ask you about the health stack being developed by the government, like the Aadhaar stack. So, you have any inputs on that part? You're on
The
mute,
National
Abhishek.
Digital Health Mission, which has been launched, is part of the one of the mandates for it is to create the health stack, which would include providing everyone a health ID, building doctor registries, building health facilities, creating a framework for electronic health records, creating digilockers for storing of health records, exchange of health information between various stakeholders, and promoting telemedicine, promoting e-pharmacies. So this entire build-up based on the health ID, based on the registries, the doctor registries, health facility registries, based on the entire framework which is being implemented by the National Health Authority, will contribute to building the health stack, which will be accessible to multiple players. It will be like the UPI for health, so that the common framework will be there, and various health service providers can access this information for building their own services. So the health stack is going to revolutionize. Health stack is going to revolutionize the way various health service providers use technology to provide healthcare. So that will be a common platform which will be available for all.
Sorry, we can conclude your session here, Abhishek. I am aware that you are supposed to go to some other meetings. So with this, we thank you for delivering the keynote address at this event of digital health, which is being organized by Elets in association with AWS. Thank you so much.
Thank you, Ravi. It was an absolute pleasure, and sorry for the little bit because the meetings got delayed and I had to join part of the thing from my car. But anyways, it was a privilege to be amongst you on this occasion.
Thank you.
Thank you.
Thank you. So we will move to the next sessions of this event, and I'm informing you all that this event of digital health is being organized by Elets today in collaboration with AWS, and also we are our next speaker is now joining in. So let me close this link and start with other link, requesting my colleagues to start the next session.